Good afternoon, everyone, and welcome to a special edition of Snapshots Live, Public Works' monthly webinar series. My name is Komate, Public Information Officer with Construction Outreach and Public Affairs. This month, in reflection of the one-year anniversary of the beginning of the COVID-19 pandemic and when our city issued a state of emergency declaration, we will hear from some Public Works employees who have been essential frontline workers and key parts of the city's response to this unprecedented public health crisis. Last year, at the beginning of the pandemic, I was deployed to the Emergency Operations Center to help our city as a public information officer for the Operations Feeding Unit, where I helped develop messaging and created a centralized food resource information webpage to assist those facing food insecurities during the early days of the shelter-in-place health order. From that personal experience, I can't begin to tell you how incredible it was to witness firsthand how many of our fellow city employees came together to help keep our city safe and running during those uncertain times. Today, we'll hear from San Francisco Public Works Acting Director, Alaric Degrafinried, about his experience leading the department amidst so much fear and uncertainty. Carlo Alfonso, Executive Assistant to the City Architect, who worked at the COVID Command Center. Julia Laue, Bureau of Architecture's Principal Architect, whose team helped ensure our most vulnerable residents had safe sleeping sites and alternative care facilities, and DiJaida Durden, Deputy Director of Operations, who will share an overview of the Operation Bureau's COVID-related work. And now, to start things off, we'll turn it over to our Public Works Acting Director, Alaric Degrafinried.
Thank you, Coma. And really, I just want to say thank you and to everyone that's on the call and to everyone that's watching and all the really and the men and women here at Public Works. As Coma said, I'll kind of just be giving you all an overview of some of the things that I've been doing here and really that we've been doing since the onset of COVID and the shelter in place. It's as it's hard to believe that it's been years that we've been here in the shelter in place. And one of the things for me and that sticks out is, and the resilience and the speed at which that we as a department were able to pivot and as immediately start to assist in the response. I mean, there was not a pause, there was no hesitation. We went from one day during our normal jobs to the next day, we're in every shelter in place, and we were as immediately hoping to do things like setting up the safe and the sleeping sites, which was a combination of our teams in operations. It involved our teams in a BDC. And as you'll be hearing about that more and for later, and from Julia, and you'll be hearing more about it and from Jada as well. You know, and that's probably the biggest thing that was just amazing to me, and the speed at which we were able to move. And we thought, you know, this time last year that the shelter in place was going to last a few weeks, maybe a month or two at the most. And, you know, and so we came into it and with the sprint, I mean, running really fast to do everything we could. And the thing that's amazing is we are still attacking COVID with that same level of energy and as resilient as if it was a sprint, but we now learned it is as a marathon. And the people here at Public Works have been a tremendous asset to the city and the region more broadly for the work that you're doing. And that's really been one of the things for me as I was able to transition into this new role in January of last year. I mean, it was only about as a 6-week period where things were normal, if you will. So the bulk of the time I've had here at Public Works has been in as a shelter in place type of as an environment. And, you know, that's been for me, one of the things that's probably been and the most difficult is just trying to find ways and to connect with you all. And, you know, because it's hard doing that over Zoom and Teams and things like that. So that's one of the reasons why some of the things I do and I've been doing here at Public Works is like I'm doing my best and to come into the office on a semi-regular basis, trying to visit the operational teams from time to time as well, just so I can try and connect and with you all, because in the times that I'm not doing that, as my involvement with COVID has been, it began out at the beginning of COVID. For the first 6 months or so, there were as daily calls that I was on, usually around the noon hour, and then every night at 6, there was a call to talk about COVID and what and so we as a city were doing, and how could the various and the departments, Public Works, HSH, MTA, the Public Safety Departments, all of us, how could we all and work together to help the city and respond. And for luckily, that's now been able to be reduced to about as 1 day a week. But at the same time, I just want to emphasize to all of us that, and we cannot ever let up. You know, we've seen our numbers for COVID ever start to go down, whether it be here in the state, in the region, in San Francisco, and certainly here and within Public Works. But again, I want to emphasize and encourage you all to still be vigilant and, you know, use precautions for social distancing. If you can get the vaccine, and please do get that, because and that's what it's going to take, and to keep us all safe. So, and for that all said, again, I want to thank you all again for as your dedication and your resilience over this past year, and as I'm certainly looking forward to seeing you all under more normal times. With that said, I will pass it along to as my colleague and to Carlo, who's and we're going to share some of the as experiences and that he's had working at the COVID in the command center.
Thank you, Alaric. It's truly an honor to be here today, to be with you guys. To the team behind Snapshots Live, thank you for having me. I am Carlo Alfonso, and I'm here to talk about working at the COVID Command Center. So I transferred to the Emergency Operations Center 1 month into starting with the Division of Building, Design, and Construction from the Bureau of Information Technology, all within Public Works. I know a lot of words, but yeah, I'm doing my best not to use acronyms. I still support the Building, Design, and Construction Division to a certain degree, but most of my work is at the COVID Command Center, CCC for short. But yeah, the Command Center is actually much more than just testing sites and vaccination sites. I mean, vaccination hubs. It's where a lot of the big decisions take place regarding the city's COVID command related response. So this is briefly like the structure of what the COVID Command Center looks like. The blue middle box, Unified Command, that's basically the group that are the top decision makers. There are also several other sections underneath them, joint information, that's they're tasked with formal communications, operations. Within operations, there's health services that oversees testing, medical, outbreak management, human services that oversees food coordination, housing, rehousing, unsheltered services. Community is another branch, and COVID vaccination, which is probably getting a lot of attention right now. Those are all within operations. The planning department where I'm in, we're in charge of like data management, visualization, situation statuses, documentation, and special projects. There's logistics, which covers resources and procurement, facilities, inventory distribution, and technology and data system support. And last but not the least, finance admin that focuses on funding, budget, and cost recovery. So the CCC, COVID Command Center, has evolved over time. It used to be 2 parts, the DOC and the EOC. And in July of 2020, they all came together and formed the COVID Command Center. It was really strategic because it streamlined processes and reduced duplication of efforts. This CCC COVID Command Center priorities continue to adjust to the changing stages of COVID. We look like we're nearing the end, so priorities and tasks will continue to change. So what I do for the CCC or COVID Command Center, next slide, please. I work in the documentation unit within the planning section. And my scope of work, I help coordinate priorities for the incident commanders through documentation support and documentation integrity. So the incident action plan in the middle of this screen is something that gets published every Friday, end of the week. It summarizes each section's objectives for each operating period. It contains objectives, org charts, safety messaging, and provides transparency in our weekly combined efforts. So any higher ups, let's say, that would come in and would like to get a brief overview of what's happening within the COVID Command Center for the week, they can basically just pick this up and read through it to see all the objectives that all the sections are doing. It's widely disseminated and it's referred to quite often. It's also a process, a weekly process where we hold everyone accountable. So there's a lot of hands that create this. My team coordinates bringing this all together. Another thing that I help with is the all hands briefing. It's an Microsoft Teams live event that airs and is recorded every Friday, much like what we're doing right now. It feels like a newsroom where you must start and end at a specific time. There's several people that put this all together. There are guest speakers, which Mayor Breed has joined in a few occasions, and a lot of other government officials. There's someone who drives the event, facilitates the event, trains the speakers, someone who watches feedback and static and tracks attendee count, does mic checks. A special shout out, by the way, to Donna DeCruz. She helped with this immensely. Basically, our predecessor dropped this off and said, here, take care of it. And her and I had to step up. So thank you, Donna. Thank you for being a part of the planning group. So I would have to say that when I was asked if I would help as a disaster service worker back in April of 2020, I didn't really understand what I was signing up for, because COVID-19 was just, it was in its early stages. And I also didn't know what being a DSW really meant. Naturally, with all that, I was a little apprehensive, but I also recognized that this was a really rare opportunity where I could be a part of something greater. I started off shaky, not knowing heads or tails of what was happening, but I knew that I had to be in the frame of mind where I had to just roll with the punches and just do your best and figure it out. It continues to be an inspiring experience, inspiring because I'm in the presence of so many intelligent, dynamic, thoughtful, and concerned people who work tirelessly to make the citizens of San Francisco and make sure that they're all well taken care of. And I know this because I have a hand in making sure that there's weekend coverage, that our days don't end on Friday, that it still carries on. The culture at the COVID Command Center is to take care of others, and just as importantly, yourselves. They truly embody the work-life balance and would frequently ask each other how you're doing. I mean, it really resonates with everyone. And I think because of this type of culture of checking in and listening, I feel like voices are being heard, voices of the community of San Francisco. different struggles and challenges from each community, like transportation issues, distress with the process, people who may not have internet access and can't get an appointment. It was really insightful to hear the challenges and the voices of all these communities. Voices of those also who work at the command center. I've always been a feminist. I grew up with a single mom and sisters who are inspirational leaders in their own right. But seeing the number of female leaders and leaders of color at the command center made me even more of a feminist. I thought maybe that's why San Francisco is doing so well with COVID-19 management. I continue to remain in awe with the many different city departments who came together for this health emergency. So many people with different talents finding ways to help the people of San Francisco. I'm extremely humbled because under these circumstances, I've witnessed kindness and thoughtfulness in the human spirit. I'm glad I was given the opportunity to support the COVID Command Center. 11 months into the pandemic, I'd say I've become really invested in how we will be transitioning out. I think when I'm old and gray, strike that, older and grayer, I see myself looking back at this time with a little more pride. Proud because I get to see how when faced with something as intimidating and damaging as COVID, so many people of San Francisco stepped up and did their best to help each other. It does not take being a part of the COVID Command Center to take care of each other. It is also in the little things we do, like washing our hands, staying 6 feet apart, doing more video and Microsoft Teams calls than we're used to, staying home or staying away from our loved ones because we worry about their safety. We all have contributed. I want to take this opportunity to thank my fellow colleagues at BDC for their continued support, understanding, and patience, and to our fearless leader, Ron Almeida, who has been so great at continually checking in with me and to make sure that I'm properly supported. Thank you for letting me be a part of this, and I'll always be grateful. On that note, it is my honor to introduce one of our amazing leaders, Julia Laue.
Well, thank you, Carlo, my friend. You are a hard act to follow. It's very wonderful to hear all about that. I commend you for all the work you've done at the COVID Command Center. And I also want to thank the Snapshots live team for the opportunity to share with you some of the work BDC and the Bureau of Architecture, BBR, has done in response to COVID-19. So I'll be talking about the safe sleeping sites and the alternative care facilities. And the safe sleeping sites were a response to the fact that the homeless shelters and navigation centers had to reduce capacity due to COVID-19. They couldn't all be as close together as they were. So this pushed many homeless people out into the streets, which resulted in a very dangerous and unsanctioned encampments around the city. And it was important to provide a safe, sanitary space to sleep during the pandemic. We started repurposing various city-owned sites, such like this one on Fulton Street. The tents were safely placed approximately 12 feet apart from each other, and the site included amenities such as hand washing stations, restrooms, electrical charging stations, and an office for support staff. This slide shows the layout for Fulton Street. Notice the spacing between the tents and then the restrooms and the offices and hand washing stations and the amenities. Here's an aerial view of the Fulton Street site. We found that vacant lots and other open spaces are typically more feasible to set up quickly, where the land site is typically flat with hard surface such as asphalt, concrete, and allows us to allocate or designate spaces for individuals who set up their own shelters within those stripes, as you can see here. And this is what they look like occupied. You know, of course, we can't guarantee that they will follow the COVID protocols, such as mask wearing and social distancing, as you can see over here on the left, but this is a big, big step. For the test bits, we're usually presented with a list of specific sites, such as these 12, to determine feasibility based on the preliminary criteria provided by the client, which is the Department of Homelessness and Supportive Housing. The Bureau of Architecture drew upon our own past and present experiences on similar types of projects, such as the navigation centers and the homeless shelters, which we have had a chance to deliver in record time. I'd like to note that our staff are particularly passionate about helping the homeless. And when COVID-19 struck, we were uniquely prepared to mobilize for a rapid response and quick turnaround. This came from the last few years of extensive work around the navigation centers and coordinating with multiple city agencies. For me, it is especially inspiring to see multiple city agencies really pull together something fast to deliver in record time when we are confronted with something like this global pandemic. And I'd also like to give a special shout out to one of my staff, Erica Martin, who has been working exclusively on these types of projects since she joined us over 3 years ago. And she's extremely passionate about this work. Another typology we worked on in response to the pandemic was the alternative care sites. And in this example, we took the old Presidio building and retrofitted it into a medical care facility on Borges Avenue. This facility was specific to emergency COVID wards. And in this case, we worked in tandem with our friends at the Bureau of Building and Repair. With these existing sites and as old buildings, the challenges we experienced are retrofitting them for a new use, expanding electrical capacity, and working within the envelope of the existing building, especially in a rapid response timeframe. Here's a plan of the existing site, which is located just as you come off the Golden Gate Bridge on ramp towards Richardson Avenue. I'm sure you all driven by it at some point or another. The alternative care sites covers a critical 3 medical needs in responsive to COVID-19. It's sort of like a field hospital, a post-acute medical shelter for patients, and a COVID shelter for patients to quarantine. This project was a great example of rapid response timeframe and the teamwork between our public works bureaus and divisions. We actually got a call, I remember very clearly, on May 1st at the initial meeting with the client, and the drawings were turned around in just a couple of days for review. And then on June 3rd, literally 30 days later, BBR started work. And then approximately 60 days after that, they had the temporary certificate of occupancy. 3+ months, that's fast. Considering the size and the work required, this was nearly record time. And the Bureau of Building and Repair, the Bureau of Engineers, Construction Management, and the Bureau of Architecture were all great partners and really pulled together in this, this particular project. One quote from one of our construction managers, Dennis Oates, who's also actually been key CM core employee for navigation centers, homeless, and this alternative care center, really stands out to me. I've had the chance to visit the Borges site a couple of times now, and I want to tell you how impressed I am with the project. The design is terrific, provides a very cozy feel that would make me feel cared for, and the construction quality is excellent. BBR crews have been friendly and helpful, and the work site is tidy and professional. This is a prime example of what BDC and BBR collaboration should be. Please pass on my compliments to the construction crew and design team. I can say personally that it's truly an honor to be working for this amazing organization because everyone has a great heart and pulls together to get things done when it is most important. And I don't think that we would have anticipated, we're all trained for earthquakes, but I don't think we would have anticipated a global pandemic. And then on a personal note, since it is the anniversary, for my team in particular, I'm really proud of them because we have approximately 69 staff and pulled together immediately when we sheltered in place to get all of our computers going, our connectivity, et cetera. And I think that we forged a tighter bond through these really tough times. And then we used to have our all staff meetings in the University of Public Works. But now we have them every 2 weeks just to bring people together. And I think we get more attendance than we ever had, actually. And we present our projects and our tips and our tricks, working together remotely. And recently we had 2 guest speakers who were very well received. All of this helps keep the morale up. And in thinking back of March of a year ago, I was also thinking that for the first couple of months, every weekend I spent all weekend making masks. And now that I think about it in hindsight, I think that was a really smart move because it kept me busy and it kept my morale up and my spirit up, and I felt like I was contributing as well. So with that said, I'd like to hand the virtual microphone over to DiJaida Durden, our new and esteemed Director of Operations. Take it away, DiJaida.
Hello, everyone. It's unbelievable to sit here and see that it's been 1 year during this pandemic. And I'd like to thank Julia for reminding me that it was one time, a long time ago, when we had the earthquake and Public Works had to work together and get through those times. And here we are again during these times, mobilizing to work together as a team to make it happen and do things that we just regularly don't do. But we did it. And during these times when the pandemic began, operations first priority was the staff and the public. It was our priority. We continued to mandate the mask and follow the safety protocols. In the beginning, it was difficult to get masks, but we got through it. And our operations, we did our own temperature checks and made sure that our staff followed the safety guidelines. We continued our daily operations 24/7 along with other job requests. We continued to fulfill the need of the COVID Command Center through the communications of the Department of Operations Command. But we still continue to persevere and keep working. And eventually we had to, in the first 2 weeks, we had to dispatch some of our workers as DSW workers to do other things. And they were tasked to do jobs like remove graffiti, help at the safe sleeping sites. We had to deliver materials. We dropped off safety PPE for other departments. We picked them up. We were helping stock in warehouses at the Moscone Center, but definitely helped set up testing sites throughout the city. Vaccines, that was important. We definitely paved areas with our operators and made safe areas for the public, maintaining social distance. We made sure that we helped everyone. BBR, they built, locked up the BART stations. They did a lot of closures. They worked real closely with BDC on the safe sleeping sites and testing sites, vaccine sites. I got to give a shout out to Jeff for coordinating with Column on helping the COVID Command Center get what they need. And they were out there doing their job consistently, all while doing their regular 24-hour jobs continuously. It was tough, but we made it through. We also had pit stops that were created because the city was on lockdown and we needed to have restrooms. So we had attendants and pit stop locations for people to use the restroom. And that was important, created a few jobs for the neighborhoods, but it's continuing on right now today. Again, BBR did a lot of work on housing, helping house the homeless, and they stayed busy and definitely helped with safety, putting up screens and dividers so people can work safely with social distancing. And they were significant to this. Along with all the other crafts and trades, we all work together, but BBR really put in an extra effort. But I wanted to say that we persevered through these times of uncertainty and we worked together to continue with the workflow. And I want to say thank you to everyone. And now I'd like to pass it over to Ben for any questions or answers for any of you out there who have a question for any of us. Appreciate you. Thank you.
All right, thank you, Jada, and thank you to the rest of our presenters as well for giving us that retrospective on Public Works' COVID-19 pandemic response. My name is Ben Peterson. I'm on the Public Works communications team, and I'm going to be handling the Q&A portion of today's webinar. If you have any questions and have not done so already, you can submit them using the chat or the Q&A button at the bottom of your screen. We have about just over 10 minutes for Q&A, so I'm going to try to get through as many of these questions as possible. The first question is kind of a open question, so anyone can really chime in if they'd like. You mentioned a lot of things throughout this webinar that you're really proud of, the teamwork and the rapid response that so many different aspects of our department have given. But if you could choose one thing that you were most proud of, what would that be? And that question is from Beth Rubenstein. Or also, what are you most proud of, and what kind of surprised you in the department's response? So if anyone would like to take the first crack at it.
I'd say, for me, the one thing that, again, which I think I mentioned before, but I am most proud of is how tireless and I don't know, is it, and the best way of saying it, and the lack of whining that you saw by the people. And for Carlos has been at the COVID Command Center for months. And Nikki, who's helping support this call, has supported. Nathan, I can think of so many people that have given so much. And it's not like you go down to the COVID Command Center and they have as Barker loungers and they're sitting back, eating popcorn all day. They're working tirelessly, long hours, getting up early, working weekends, and it's just the commitment, really, as Carlos said, and to something bigger than which is actually, if you think about it, the things that we do is already saying a lot. Just in Public Works, day in, day out, we're already committing something that's bigger than what we are. But this is actually taken it to a whole new level of commitment. And so I can tell you, that has, I am profoundly proud of each and every person that's been involved in that process. And whether you've been at the COVID Command Center or not, because again, the fact that you all are doing your jobs and 1,600 other people in these crazy times of, and having to deal with, and the screaming kids and the internet being slow and, trying to commute in on BART, which I'm doing from time to time when the BART schedules are different. Everything is just so wacky this last year. And I have not seen any project or any person just stop working. It's just, we continue just to plow through it all. And so for me, that's been probably the biggest thing that I'm so proud of. And frankly, it's because of that, you all has inspired me to not whine, or at least I should be clear, I don't whine as much as I would normally whine. I'm trying to scale back because you guys, has to make me feel that, hey, if everyone else can do it, I can do it too.
Great. Thank you, Alaric. Like you said, so many people have sacrificed so much over this last year, and it's really, really great to see. Does anyone else have anything to add?
I could just say that I'm really proud of my team. Day one, they totally mobilized to get working because, as architects, we usually work together, collaborating, side by side at a drawing table. So to go remote on the computers, it was a big deal. And I think nobody whined. I like what Alaric said. Everybody just really pulled together. And I think often of some of my staff who are home alone, or the ones that also have 3 kids, they're screaming in the background. And the parents that have to be, or managers that have to be parents and teachers all at the same time. So I think I just feel very blessed to have that kind of team.
Great, thank you, Julia. The next question that we have is for DiJaida. During your part of the presentation, you talked a bit about expanding the pit stops program during the early days of the COVID-19 pandemic. I was wondering if you could tell us a little bit more about that process and specifically how all those new sites were chosen so quickly. And also if there are any difficulties securing staffing for all of these new pit stops with such a quick timeline.
Great question. Great question. So how we picked the sites were based upon public access where people during these times traveled. So traveling to the bar, to the bus, in the areas of need. Of course, where areas where people weren't not traveling as much, we didn't put them there. And then once we put the pit stops in, we did a tally of how many people were going to the restrooms during that time. So we chose whether to keep them there or move it to another area where we thought we needed to have it. And thus far it's worked, putting it in areas where the need was, where people were at. And we focused in on just watching and being out there in the field, understanding where the need is for the public and also our staff as well. And that's how we figured it out. And but it also helped with the community because we had contracts through communities that help provide jobs to have monitors sit at the pit stops. So when you go in, they would help sanitize them and make it safe for everyone, during these times, touching and, people just going through places, and it created some jobs as well. So we helped as much as they helped us. We worked together.
Great. Thank you for that. And just to follow up, are there any plans to keep these new pit stops in operation as the COVID pandemic subsides, when it does fully subside, or is it something those are just purely temporary locations?
No, there's a plan to reduce, yes, but we'll continue to have the pit stops where needed at. Yes, great. Absolutely.
All right, thank you.
Welcome.
Our next question, I guess it could really be for any of the panelists, since a lot of you are in kind of management positions. Was it difficult or sometimes even intense balancing people's employees and colleagues' fears of the contagion and the virus while also, addressing the needs of the city? It seems like it'd be, pretty difficult territory to, to navigate with, so many people having so much fear and uncertainty, especially during the beginning of the pandemic, around going outside or, a lot of the things they need to do to perform their normal course of work. So if you could, any of you could shed a little bit of light on how that played out.
Definitely at operations, the uncertainty was high here on the yard. And I think that communication, having meetings outside instead of enclosed areas, we created posters. We weekly updated them on the changes that the state was mandating. I mean, during this pandemic, we changed policy every other month on rules and regulations. And so we communicated with them continuously and took on recommendations, and we implemented hand sanitizers all over the yard, electric ones where you just swipe your hands, no touch, or here's a bag of, we just communicated constantly with them and listened. People want to be listened and heard on their issues and worries, and we just try to reassure them that we're here to help them through this process, and we're gonna do this together. And that's how I feel as a manager. And I didn't leave and stay home. I stay here at operations 24/7 with them, and that helped them get through till today as well.
Yeah, and Ben, I mean, and I'll echo everything that you just heard from Jada. And those first few days, we just didn't know. I mean, yeah. I remember we having real conversations about, do we send everybody home, including operations? But then we quickly realized our jobs are so essential that we can't, we have to find a way to do our jobs, and somehow trying to balance the safety and the security of our as employees, which is of the utmost and the concern to me, with the same the counterbalance of the the security and the safety of the people and the businesses here in San Francisco. Because if we're not here, and they're not going to be safe, you know, the streets, the litter, I mean, all that. So it's a really hard thing to balance. And I was talking about it this past weekend and with Carla Short, and I don't know if you all remember, but about this time last year, we were planning as an Arbor Day event for Saturday, and we were going to have people volunteer. And it was on that Thursday night, we were struggling, trying to figure out, do we cancel it? Because we just didn't know if it was going to be safe. And we did. And we went through so much heartache coming to that decision. And I'm so glad we did. But again, it was just, we just didn't know because there was no guidelines coming out at the federal or the state or even the local level, because our own and health officers had not given us enough information. So we were just really trying to do what we thought was right, crossing our fingers and everything, and just hoping. And again, I think in as a lot of ways we got lucky, but that is because we have such a strong as a management team, and we very quickly ever huddled and started to think through some of those same issues. And another thing I'll mention very briefly too is, you know, thinking about you all, and you know, and when is it going to be safe to come back and things like that. I can tell you as a city, those are things we are beginning and to think through and right now. And certainly I will not be recommending that we come back until we know that it is going to be safe for all of us. And then I will never ask anyone to do something that I wouldn't as do myself. And that's why, for example, I know that there is a lot of hesitation and concern with any number of things. But I mean, for example, as you can see me and routinely on BART as with my daughter. And I know there's a lot of hesitation to start doing some of these things, but you can do these things in a safe way. If you can maintain your social distancing, wearing your mask, washing your hands infrequently. So I just want you all to know, when we do get to that point, when we do start to open things up more broadly, that it will be done in a way that'll be safe. And I can assure you that as it won't be done until as it is safe. It is something that and we are not going to rush into.
Thank you, Alaric, for sharing that. It's definitely seems like you know, a lot of the tone is set at the top, and it seems like, you know, Public Works management and higher levels of people have really done an exemplary job of doing that over the last few months and the last year as well. It looks like we are about out of time for the Q&A portion of this webinar. Thank you to all of our panelists again for answering all those questions, and to everyone who submitted questions as well. I'm going to hand it back over to our host, Koma.
Great, thank you, Ben. So this concludes a very special installment of the Snapshots Live webinar series. Thank you again to all of our presenters and to everyone who attended as well. We had over 120 people join us this afternoon, so thank you for taking time. If you'd like to share your own experience, please consider participating in the digital COVID time capsule. For more information, check your email from hello@sfdpw.org that was just recently sent. Keep an eye out for next month's webinar, where we'll be celebrating Earth Day by learning about Public Works' effort to build and maintain San Francisco's urban forests. Thank you all for joining us, and have a great afternoon.
And thank you all.